So this was a case that I did many years ago. I actually showed this at the osteodensification symposium, the first one that we had back in Orlando. And we placed the implants guided through a surgical guide. When we did that, we used the densifying burrs to place them. So we weren't widening out the crest. We were trying to expand it. But we still have a defect, and we can't leave these defects. What's going to happen if we leave this alone? We're going to have food traps. We're going to have the patient having very uncomfortable brushing episodes. They're going to complain. We create what I like to call dessert trays. You leave too much space underneath the buckle of the crown. The patient goes for dinner. They come home. They do a little swipe with their tongue. Ah, dessert. 2 hours later. It's not fun, especially when you're paying lots of money to get a tooth. Your patient didn't come to you for an implant. They came to you for a tooth. And a tooth doesn't usually have food stuck there if it's natural and how it should be and we're maintaining. So we see that we have a lack of bone profiling here. So we're going to have to modify this. We're going to have to change the shape to accommodate. And in this case, we're doing an immediate load. So we're going to put a final zirconia abutment. So the first thing we do is put that guide pin on. We use the bone profiler, and we create the space. We create the emergence profile. This is what we do. It's standard implant placement to allow the acceptance of the shaped final abutment. Here we use temporary crowns, and we insert them the same day. We torque them in. That wonderful feeling when you put on the temporary, and you put it on and it just fits perfectly and you don't have to adjust anything. Such a great feeling when you have these cases done. You know the patient's leaving with teeth and all is right in the world.